Hey, once again, I'd like to welcome you all to the webinar titled Accessing and Using Data from 3 Evaluations of Career Pathways Programs. My name is Brinda Mahishi, and I am a Data Project Manager for the Child and Family Data Archive. I am joined today by my colleagues Nicole Constance from the Office of Planning, Research, and Evaluation, or OPRE, and Douglas Walton from APT Associates. Nicole and Doug will lead the presentation today, but before I turn it over to them, I will briefly introduce you to the Child and Family Data Archive and let you know more about the structure of this webinar. This webinar is hosted by the Child and Family Data Archive, also known as CF Data, which is where you go to access Career Pathways Programs data, including the HPOG and PACE datasets. CF Data is supported by a contract from OPRE and housed at ICPSR within the University of Michigan. It is the place to discover, access, and analyze data on young children, their families and communities, and the programs that serve them. Users are able to access over 350 data sets with the ability to analyze select data sets online. Users can also search and compare variables and peruse data-related publications. And of course, user support is available to assist you in finding and obtaining data. I will go into more detail about the archive later in the webinar. For today's webinar, Nicole and Doug will provide you with an overview of the Career Pathways programs, as well as information on the data file structure and conventions and data user resources for PACE and HPOG 1.0 and 2.0 data files. Following these sections, I will give an overview of CF data and the resources that we have available. Importantly, I will share how users can request access to the Career Pathways Programs data through the CF Data website. Finally, we'll close this webinar with a brief question and answer session. And now I am very happy to pass the presentation over to Nicole to share an overview of the programs.
Thank you. So as Brenda said, my name is Nicole Constance. I am with the Office of Planning, Research, and Evaluation, and I was the federal project officer who oversaw the 3 projects that you're going to learn more about today that you can, for which you can access the data and analyze it yourself. So I'm going to start by giving you sort of a high-level overview of these projects, and then I'm going to turn things over to Doug, who will actually talk about the data files. So just a little bit of background on our Career Pathways portfolio. So it launched in 2007 with our Pathways for Advancing Careers in Education project. And when we started this project, we didn't actually have in mind that we are going to be evaluating career pathways programs. That was decided after an intense early period of input from lots of stakeholders and just trying to decide what was the next big thing in this area for improving self-sufficiency among families with low income. And with that input, we settled on career pathways as a new and promising approach to improving family self-sufficiency. Then in 2010, the Affordable Care Act authorized the Health Profession Opportunity Grants Program and intended for that program to be based on career pathways. So when that happened, we were already building our portfolio in this area, and then HPOG became a major component of it. So in 2012 and again in 2016, we contributed to interagency joint letters committing to promoting the use of career pathways. So this was a government-wide initiative. So broadly, our portfolio includes the PACE project, evaluations of 2 rounds of HPOG, which we refer to as HPOG 1.0 and HPOG 2.0, as well as some secondary data analysis grants. And our portfolio is situated amongst other ongoing career pathways evaluations that are being overseen by the Department of Labor, Department of Education, the Department of Agriculture, and others. And if you hear my puppy barking in the background, please forgive me. I'm hoping by telling you he's a puppy, you'll be more sympathetic. So this is the career pathways framework that we're using to sort of organize how we're thinking about these programs. So career pathways provide post-secondary education and training organized as a series of manageable steps, leading to successively higher credentials and employment opportunities in growing occupations. Broadly, they incorporate 4 core program strategies, assessments of needs and skills so that people are placed into the right level of occupational training, innovative approaches to basic skills instruction and occupational training. So this includes things like accelerated training, contextual training or contextualized training, academic and non-academic supports to promote student success. So this is academic supports like tutoring and non-academic supports like help with childcare and transportation assistance so that they can get to and from class. And the fourth component is connecting students to career track employment. So let me talk a little bit more about PACE. As I said, it was launched in 2007, and through our site recruitment process, we identified 9 promising career pathways programs. 6 of the 9 have an exclusive or primary focus on occupations in the healthcare sector. And in fact, 4 of the programs were affiliated with the HPOG 1.0 program. 3 were grantees and 1 was a sub-grantee. Across the board, the key research questions we were looking at were, what is the impact of each program on indicators of educational progress? What are the impacts of each program on employment and earnings? And also, what is the basic design and underlying logic of each program? What are its elements? So to answer these questions, we conducted implementation and impact studies in each site, including several waves of long-term follow-up. A little bit more about PACE. So each program is pretty different, each of the 9 programs. And so for that reason, and just differences in the logic model, we decided to treat these as 9 separate studies. Each program targeted a sample size of about 1,000 people, including people in the treatment and control group. There are very big differences in the sample characteristics between programs, which are reflecting the priorities of each program. So for example, one of the programs, Year Up, specifically targets young adults aged 18 to 24. Another program, the Carreras en Salud at Instituto del Progreso Latino, targets Latino adults in the Chicago area. Just to give you an example of what I mean by the wide variety of sample characteristics. For the data sources, we have data from implementation study site visits, participant follow-up surveys, baseline data. I forgot to mention that in this bullet here. Participant follow-up surveys at 18, 36, and 72 months after random assignment. We conducted in-depth qualitative interviews with participants, though that data is not archived. And we also have administrative data from program records, college records, the National Directory of New Hires, and the National Student Clearinghouse. Some of that data is archived, some of it is not. Doug is going to talk about that a little bit more. So this quickly is just a map of where all the programs are so that you can get a visual of that. And now I'm going to move on to talking about HPOG. So as I said, HPOG was authorized in 2010 as part of the Affordable Care Act. Its role was to provide education and training to TANF recipients and other individuals with low incomes for occupations in the healthcare field that pay well and were expected to be have labor shortages or be in high demand. So they were supposed to target the skills demanded by the healthcare industry, including providing training that would lead to some sort of credential that had value in the labor market. They were, supporting career pathways, providing support services, and implementing their programs in collaboration with lots of partners. HPOG was authorized as a demonstration program with a mandated federal evaluation. And so our office, OPRE, is using a multi-pronged evaluation strategy to assess the success of HPOG 1.0 and 2.0. So HPOG 1.0 is the grants that were awarded in 2010. They were given to 32 organizations, including 5 tribal organizations. HPOG 2.0 was awarded in 2015, again to 32 organizations. 17 of those 32 are returning grantees, which means they were part of HPOG 1.0 and are again part of HPOG 2.0. So because we have I wanted to spend a little bit of time highlighting some of the similarities and differences between our evaluations of HPOG 1.0 and 2.0, and the ones on here that are in bold and italics are the ones that I think are probably of most interest to this group who's in attendance today. So similarities. In both cases, we designed and maintained a management information system to collect uniform data from all HPOG programs. There are different systems for 1.0 and 2.0, which Doug will talk about a little bit, but we do have this program data, uniform, consistent program data for both rounds. In both cases, we conducted an experimental impact evaluation to estimate the overall impact of the HPOG funding stream. What I mean by that is that we did the impact evaluation in all or most of the programs, and we pooled across the programs to estimate the impact of HPOG as a whole, rather than in the case of PACE, looking at programs separately. In each round, we also conducted implementation, outcomes, and system studies for the non-tribal programs. We conducted implementation and outcome studies for the tribal programs, and we had some university partnership grants, there's more information about those on our website. Some of the differences between 1.0 and 2.0. In HPOG 1.0, in some of the programs, we did a 3-arm test where people were randomly assigned to the control group, the standard treatment group, or the enhanced treatment group, where they had access to one of 3 program enhancements so that we could experimentally test the value add of those particular program enhancements. And those were emergency assistance, peer support, and non-cash incentives. Also in HPOG 1.0, I referenced this earlier, 3 of the grantees were evaluated separately as part of PACE, plus the 1 sub-grantee. And in HPOG 2.0, we conducted in-depth interviews with a sample of HPOG participants, and that is relevant because that data is archived. So some of you who are interested in secondary analysis with qualitative data will be able to do that. So a little bit more about the particular studies that we're talking about or that are available for analysis. So there's data from the National Implementation Evaluation of HPOG 1.0. It included all 27 of the non-tribal HPOG 1.0 grantees. Those 27 grantees operated 49 distinct programs. Over the 5 years that they were operating, they served over 36,000 individuals. And the key data sources for NIE, as we call this, were surveys with grantee informants and other staff, partners, and employers, data from the Management Information System, which is the Performance Reporting System, or the PRS, employment and earnings data from the National Directory of New Hires, and data from the 15-month follow-up survey. And there's more information at this link. So also, we have data from the impact study of HPOG 1.0. So this included 23 of the 27 non-tribal HPOG 1.0 grantees. Those grantees operated 42 distinct programs. There are just under 14,000 people in the study sample. It was an experimental evaluation. Random assignment began in March of 2013 and ended in November of 2014, which is why it's only a subset. The programs were already operating before we started random assignment. As I mentioned, 19 of the programs participated in this 3-arm test, and our key data sources from the impact study are baseline data from PRS, follow-up surveys at 15, 36, and 72 months after random assignment, and administrative data from NDNH and the National Student Clearinghouse. So something that I just wanted to note a little bit, we started off with PACE and HPOG, the HPOG impact study, as 2 separate studies. And they were doing pretty similar work. They had pretty similar survey instruments, but there are some differences. And Doug's going to talk about that a little bit. And then when we move into the 36-month phase, we really made an effort to make sure that we could maximize our learning across these 2 large investments. So from this point, we're using more or less the same survey instruments, the same data, the same asking a lot of the same questions so that we could, as I said, maximize our learning, and that carried forward into our long-term 72-month follow-up. So now I'll talk a little bit about the HPOG 2.0 national evaluation. So again, these are the grants that were awarded in 2015. This time, all 27 of the non-tribal HPOG 2.0 grantees participated in the impact evaluation. Those grantees operated 38 distinct programs. Across the entire time that HPOG 2.0 programs were operating, they randomly assigned more than 50,000 people. Random assignment began when programs began their operations after a brief planning period, so that random assignment started in the earliest programs in February of 2016, and it ended in September of 2021 when all of the HPOG 2.0 programs ceased operation. Our key data sources here are baseline data from PAGES, that's the management information system that the 2.0 grantees used. We have follow-up surveys at 15, 36, and 66 months after random assignment. The 36-month data collection has concluded, and we are in the process of releasing the report for that. For the 66-month follow-up, data collection has not yet begun for that. We've also started what we call the COVID cohort survey, which is a 15-month survey of people who were randomly assigned after the onset of COVID. So programs continued operating and serving people, but we wanted to capture and understand some of the differences between the pre and post-COVID era in a program designed to train people for healthcare. So we have launched that survey, and that is currently in the field. We also have administrative data from NDNH and National Student Clearinghouse and in-depth interviews with a small sample of program participants. So I'm going to close out my portion just by telling the people who have joined us today that we currently have forecasted a grant opportunity, the Career Pathways Secondary Data Analysis Grants. They are intended to support rigorous policy relevant secondary analysis of these career pathways data sets that we're talking about. Here is a link to the forecast, and it was just dropped into the chat for you. So I'm going to pre-warn everybody that I'm not really allowed to answer questions about this other than to reiterate things that are already in the forecast. So please do read the forecast. And if you want to be updated about when this goes from forecast to actual opportunity, at that grants.gov website, you can click on the red subscribe button on the top right corner. You can also sign up for the OPRA newsletter. We'll make sure and announce there, and follow us on social media. So on my last slide here, here at the bottom are ways to follow OPRA, sign up for our newsletter, or follow us on social media. So that is it for me. And now I'm going to turn things over to Doug.
Great, thanks, Nicole. So my name's Doug Walton from Apt Associates, and I'm going to give an overview of archived data files from ACF's Career Pathways evaluation portfolio. I want to start by briefly thanking everyone again for attending today's webinar, and to mention that our team at Apt is excited to be a partner on this project, and we're looking forward to discussing how these archived data files can support new research. I'm going to give a few quick introductions. So at Apt, we have a very large team who have worked on these projects over many years. I'm the data collection and documentation lead for this work. Also want to mention a few project leaders. Larry Buron is the project director for the 3-year and 6-year follow-up studies for HPOG 1.0 and PACE, and the HPOG long-term, HPOG 2 long-term follow-up. We're also joined on the call today by Dave Judkins. He's the director of analysis for PACE and HPOG 2, and he can help answer questions during the Q&A. I also want to mention the director of analysis for HPOG 1 is Dan Litwack. I want to acknowledge and thank ACF for funding this work, and note that the material in this presentation does not necessarily reflect the views of our funders. So we'll start with a quick outline of my slides. I sort of organized the material by study. So we'll start with the PACE files. We'll talk about the contents, the sample, how they can be linked together, some of the key features and strengths of the various files. Then I'll do the same for HPOG 1.0 and HPOG 2.0. Talk briefly about data limitations and considerations, what we couldn't archive, trade-offs between different data sources, things like that. Provide links to additional resources. With all the data files, it's just simply not possible to cover all the interesting detail in this hour-long session. So we'll be sure to point you towards where you can find all that detail. And then some time for question and answer. And just to reiterate, the goal of sort of these slides is to help you better understand the structure of the data, how the files can be linked together, and be aware of resources to find additional details for potential work. All right, so let's jump into the PACE data files. In the archive, there are 15 different PACE data files. I'll go through each of them in some detail, but I'll just start with a list. We have baseline and short-term follow-up survey data. These are participant level data files. We have implementation study data. These were based on surveys that were fielded to program staff. We have 3-year follow-up survey data and 6-year follow-up survey data. Both of these are participant level data files. So we'll go through these in some detail. So we'll start with the baseline data. The baseline data is contained in two forms, two files. The basic information form, the BIF, contains demographic and background information from participants. We collected this on paper forms at the time of study enrollment. The self-administered questionnaire measured participant attitudes, personal qualities, and challenges. So these two files together constitute the baseline data. The data in these files would be very useful for users as covariates and statistical models, or to define subgroups based on characteristics at baseline for looking at how program experiences or outcomes might vary across different groups. In general, there's a bit of non-response, but generally low. We implemented minimal coarsening in the archive data files. Rounded some dates from exact dates up to month and year to reduce the risk of identification. The sample here, which is the full PACE sample, 9,242. As Nicole mentioned, the analysis was done separately for each of the nine sites, but it's all included in a single data file. And across all the PACE data files, all the files have the same PACE ID, so they can be linked, except for the implementation data, which I'll mention. All the individual level files could be linked together using the PACE ID. So that's the baseline data. Next, we have the short-term follow-up survey. This was completed by participants about 18 months on average after random assignment. We had a response rate of 77%. Conducted the survey by phone with in-person follow-up for those who didn't complete. The survey collected a rich set of data across a variety of domains, including educational progress, employment success, psychosocial skills, indices of career knowledge, life challenges, family economic status. So it's a real rich look at the experiences and the status of participants over the short term in the 18 months after random assignment. So this is the archived version of all the raw survey responses. We also included the short-term analysis file. This includes all of the recoded variables from the BIF, the SAQ, so the baseline data, and the short-term follow-up, plus non-response weights. In some cases, we were also able to include the imputed values, where we imputed certain variables for missing data. So with this analysis style, these are the variables we used to estimate impacts on survey-based outcomes in the published reports. So if you're looking to replicate results in the reports, this is the file you would want to look at. The important limitation is that we were unable to include variables constructed from a few sources due to limitations imposed by the data providers. Notably, this includes college records, data from the National Student Clearinghouse, the NSC, the National Directory of New Hires, the NDNH, which was our source of quarterly earnings and employment data. So because these couldn't be archived, it's not possible to replicate the results that were published in the reports that relied on these data sources. And the sample here is one file for all nine PACE sites. I'll shift now to mention briefly the PACE implementation survey data. So these were the surveys that were fielded to program staff. They were fielded online as part of the implementation study to understand, better understand staff perspectives about the structure and the operation of each program. We fielded 3 different types of surveys to 3 different types of staff. Because of the small sample size and we didn't want users to be able to associate specific responses, specific grantees. These responses can't be linked to the participant level data, and the responses don't include site name. Now, the 3-year follow-up survey, this was fielded median follow-up 39 months after random assignments. I think the key feature to mention about this survey is the longitudinal, so not included in the short term, but in the 3-year survey, we added a longitudinal education and employment history module. This module collected information about every school and every work experience since random assignments. So start and end dates and activities that were going on for each school experience and each work experience. So it permits really rich longitudinal analysis of school and work trajectories over the first 3 years after participants joined the program. So if you're looking at some longitudinal work, this might be a key data source to look at. There were some missing data in here due to survey skip outs. These are flagged in the data, and there's more information in the report appendices, but just to mention here briefly. And in terms of the structure of the data, because the survey was designed as a series of modules, we have different data files that sort of align with those modules. So we have a data file for credentials with one response per credential, a job spell file, a school spells file with 1 response per job spell or school spell, a job conditions file with 1 response per person with at least 1 reported job. And then for anything that wasn't spell-based, within anything that was just 1 response per person, we have a person level data file. So that's the survey data itself. And then similar to the short term, we have a 3-year analysis file. This is a person level file with the survey-based outcomes and covariates and subgroups that were used to generate the impacts reported in the 3-year impacts reports. It contains the full PACE sample. And again, because of data limitations, we couldn't include NDNH or NSC data. So similar to the short-term analysis file, if you're looking to reproduce the results that were published in the 3-year reports, this is the file you probably want to start with. And finally, move to the PACE 6-year data files. We fielded a 6-year follow-up survey to participants at 4 selected programs. They're listed here. These programs were selected in consultation with OPRE. So it's only fielded to these 4 programs. So we have a little over 3,000 respondents. This was for this survey, we did not use the detailed longitudinal employment education module. Again, this was just a flat survey, so one record per person. Although we did collect, we did allow participants to report multiple credentials if they earn multiple credentials. Given that most participants had already completed their PACE training by the time they received this survey, the instrument included more questions about sort of job quality and life outcomes, economic outcomes, family outcomes, sort of less with less focus on education and training, since by this time most of the education and training had been completed. And then the 6-year analysis file is a person level file with all survey-based outcomes, covariates, subgroups needed for the 6-year impacts reports. And as with all the PACE data files, and HPOG 1 and HPOG 2, we didn't include NDNH or NSC variables. So that concludes PACE. We'll move on to the second program, HPOG 1. Now there's some complexity nuance with how available HPOG1 data varies across samples and over time. Nicole alluded to some of this. So I want to take a minute to talk about those before we get into the data files, since I think that'll help that discussion. So here's a little visual. On the left-hand side, we have participants who had access to the HPOG program. On the right-hand side, are study participants without access to the HPOG program. So on the left-hand side, those with access, all study participants were part of the implementation sample, the National Implementation Evaluation, the NIE. A subset were also part of the impact study. They were randomly assigned to have access to HPOG. Right-hand side is the impact control sample. These are those who were part of the study, randomly assigned to not have access to HPOG1. The data varies across all these samples and over time. So we have PRS, this is the grantee MIS system. We have PRS baseline data for all participants. We have PRS post-enrollment program data for the left-hand side only, those with access to the HPOG program. We have short-term follow-up survey data for the impact samples, both treatment and controls, but not the non-impact implementation sample. Another complication are the so-called dual HPOG PACE participants. Nicole mentioned this earlier. There were 3 grantees and 1 sub-grantee were part of both PACE and the HPOG evaluations. At these dual programs, the baseline and short-term follow-up instruments differed slightly. Those are the dual programs completed the PACE version of the instruments, and those were slightly different than the HPOG1 version of the instruments. So that complicates the short-term analysis a bit. We wrote about this in the HPOG1 short-term report, so if you're curious about how to think about those nuances and differences, you can refer to those details. In the HPOG archive data, we included extracts of the PACE version of the instruments so that you have all that data. If you're working with HPOG1, you'll have extracts of the PACE version for the dual site participants. It's more straightforward at 3 and 6 years. We use the same instruments for PACE and HPOG1, so there's no difference between the dual sites and the HPOG only sites. So hopefully that discussion makes the following slides easier to follow and didn't muddy the waters too much. So we'll turn now to the data files. So for HPOG1, we have 22 archive data files. Again, I'll start with a list and then go through each of these groups in detail. We fielded implementation surveys to program staff. We archived the short-term follow-up survey, the HPOG version for the HPOG only sites. We have the short-term impact analysis file. We have program records from the performance reporting system, which are spread across 6 tables. We have baseline and short-term data for the dual HPOG PACE sites. These are the extracts of the PACE version of these instruments for the participants at the dual sites. And then very similar to PACE, we have the 3-year and 6-year follow-up data files. So let's look at the HPOG PRS. So the PRS was a web-based management information system. It was used for program management, performance reporting and monitoring, and evaluation. It was data was entered into the system by grantee staff, and because it was used for reporting and monitoring, we're relatively confident in the quality of data that was recorded by grantees. It's a big relational database with records organized across tables, and so we archived each table individually. It's not in operation through June of 2016. And we implemented some coarsening to reduce the risk of re-identification, but not all that much. So that the data is still pretty detailed. There's 6 different tables, and the sample varies a bit by table. Is really sort of 3 different groupings. So the entire sample has data in the participant file. This has person level demographic and background information. The impact sample, both T and C, has data in the impact supplemental table. This contains person-level data that was used in the impact study on participation expectations, barriers, various self-assessments. And then for those with access to the HPOG program, if you think back to the visual, the left-hand side there, both implementation and impact treatment, there is activity level data recorded by grantees on services received during the program, educational activities during the program, employment, including both job employment and employment development activities, and activity level data on occupational training. So those latter four files have multiple records per person, sort of one record per activity. All the PRS tables can be linked at the person level. There's an HPOG ID on all of the HPOG1 data files, so they can all be linked at the person level. I think that, yes, that's the PRS. Next, we have the HPOG short-term, HPOG 1.0 short-term follow-up survey. This was completed on average about 18 months after random assignments. It was similar but not identical to the PACE short-term follow-up survey. So again, so really rich data on educational experiences, employment success, psychosocial indicators, economic well-being, family well-being. For the participants at the dual HPOG PACE sites, we included extracts of the PACE version of these instruments, which we talked about previously. The HPOG 1.0 short-term impact analysis file. This is where we blended data from the PRS, the HPOG follow-up survey, the PACE version of these instruments for the dual site participants. We included measures of program characteristics, implementation features, and local context. These were all used in the analysis of the effects of program characteristics on impacts. So basically, anything we use for the short-term impacts report can be found in this file. Unlike PACE, for HPOG 1, we used ND&H data to generate non-response weights and imputations for missing data. Because we use ND&H data in the models, we couldn't archive the weights or the imputations in the archive data files. So it's not possible to precisely replicate the published results because there aren't weights or imputed values in this data file. And as I said before, it does not include quarterly employment or earnings outcomes from ND&H and NSC. Briefly mentioned the HPOG 1 implementation surveys. These were web and phone-based surveys of grantees, employers, and staff, very similar to the PACE version of these surveys. And as with the PACE version, the implementation survey data files can't be linked to the participant level data files. And they're anonymized, so they can't be matched back to specific grantees. The 3- and 6-year instruments were identical to the PACE version, so I'll only spend a few seconds on these. Again, the 3-year follow-up survey has that really rich, detailed longitudinal education and employment history module. So that's a great source for looking at sort of longitudinal experiences in education and employment in the 3 years after random assignment. Data split across the same 5 data files as PACE. 3-year analysis file contains the outcomes reported in the reports. In the HPOG 1 6-year follow-up survey and analysis file, again, these are the same as the PACE instrument. The 6-year survey was fielded to a 20% subsample of participants in the HPOG impact study. So it's a smaller sample than the prior rounds. And the analysis file contains all the survey-based outcomes that were reported in the report. Finally, I'll turn to the HPOG 2.0 data files. So here we have 11 data files plus, hot off the press, transcripts from the in-depth participant interviews. So again, here's the list of these, and then we'll go through these in some detail. So HPOG 2.0 pages. This is similar in nature to the HPOG 1.0 PRS. So for HPOG 2.0 pages is the web-based management information system, again, used for program management, performance monitoring and reporting and evaluation. The sample here is over 57,000 HPOG 2.0 participants from non-tribal grantees. I don't recall if I mentioned this. I mean, HPOG 1.0, the data files, so all the HPOG data files exclude tribal grantees, the tribal data. Any tribal data in the PRS or pages are not included in the archive data files. There are 6 pages data files, a participant level data file with characteristics collected at intake, and then 5 activity level data files containing information on eligibility screening, support services received from grantees, employment outcomes and job characteristics, remedial pre-training activities, occupational training activities, and then a grantee file with activity level data on the services and activities provided by offered at each grantee. And all of the HPOG 2 data files have an HPOG 2 participant level variable, such that the files can be linked together at the participant level. The HPOG 2.0 short-term survey was fielded on average 17 months after random assignment, 74% response rate. This was similar in structure to the PACE and HPOG 1 3-year survey, so it had that detailed education and employment module. So again, a great data source for any sort of longitudinal look at patterns in employments and education in the 17 months after random assignment. 5 data sets here, a person level survey data file, an analysis file, which contains the recoded survey outcomes, and then 3 spell level data files, job spells, school spells, and then a scaffolding that's sort of spell level data that can be used to construct the spell history. Then lastly, very hot off the press, just released quite recently, APT conducted about 150 semi-structured in-depth interviews with selected HPOG 2.0 program participants. They were semi-structured interviews that covered a common set of topics, things like career pathways, job and school histories, experiences in the training, challenges with managing work, family and training, financial well-being, things like that. We archived the redacted transcripts, and they're available from ICPSR. Due to additional restrictions on the data, because it's much more detailed, it's located on a separate study page with, I think, a separate application. But it is available in the archive. And then future HPOG 2.0 data files, we'll be archiving data from the grantee survey, and then eventually 3-year impact study data and 6-year impact study data. I have a few minutes left, so I want to talk very briefly about data limitations. So we talked about many of these items before, but some data sets were not archived, NDNH, NSC. We did some coarsening to reduce the risk of re-identification, including coarsening exact dates and some exact numeric values. Some imputations and non-response weights are not available. This is the HPOG 1.0 data, because the calculation of these imputations and non-response weights used NSC data. The implementation surveys can't be linked back to participant level data files. And then, as we mentioned, the PACE and HPOG 1 baseline and short-term instruments differ slightly, so that's relevant for HPOG 1 users who need to account for that if they're including participants at the dual sites. And then just some brief considerations here to help you think about what data is appropriate for your research question. For PACE, you have the option to either use the raw survey or the fully derived and imputed outcomes, and that decision could be, could come down to whether you want to replicate what was done in the published reports, or whether you want to treat things, things differently, or look at, data that we didn't use in the reports. Then for HPOG, you can choose between whether using the survey data or the PRS, and the same thing applies to the HPOG2, the survey or the pages, to measure outcomes. And there's, sort of strengths and drawbacks of each of those. I think I'll just skip over that in the interest of time. So instruments, code books are available on the ICPSR study pages, which I think were popping up in the chat. So thank you for those. And then all of the very detailed analytic details are available in the evaluation design reports, analysis plans, appendices to the impact reports. That's all available, this link here. And then to reiterate, we're always happy to help our team at APT. You can direct questions to folks at ICPSR, and then those will eventually make their way to us, and we're happy to answer questions as you're considering your research. And that wraps up my piece, and so I'll turn it back to, I think, to Verinda.
Thanks, Doug. So yes, I'm just going to quickly go over some of the resources that we have at CF Data that I think will be of interest to users here. So just to refresh, CF Data preserves and disseminates data on topics related to young children, their families and communities, and the programs that serve them. So the PACE and HPOG data sets are just a few of the hundreds of data with data sets with accompanying documentation that we have available. And all of these data are available to researchers to analyze free of charge. We have various different types of data, including federal and state funded program data, administrative, community-based surveys, and observational studies. And our CF Data website is available at childandfamilydataarchive.org. And you can go here to explore data, learn more about childcare and early education research, and discover the training opportunities presented by CF Data. You can visit our About Us tab to get more information about new data releases and upcoming trainings and announcements. And we encourage you to visit the video resources page on the website, which is under the newly named resources tab. And here you can find videos of data release webinars and accompanying slides. And you can filter here. So the videos of today's webinar will also be added to this page when it is available. So that was just a brief overview. So we encourage you to visit the website and click on the About Us video or page, where you'll find a fun short 2-minute video that introduces you to the collection and the resources that we provide. So now let's turn to how you can access the HPOG and PACE data. You can begin by typing HPOG into the search bar on the home page, and then that'll lead you to the search results page where you see HPOG is the first study that shows up on the search results list. And when you click on that, it'll take you to the study homepage, which we have a screenshot of here, the HPOG 1.0 study homepage. So the homepage is where you will find important information, such as a summary about the study and information on the study's methodology, sampling, weights, and more. It's also where you can search and compare variables and view publications based on the HPOG 1.0 data. So just important to note, while users may preview and download the public documentation located on the Data and Documentation tab, a restricted data application is required for users to gain access to the restricted data. So the Data and Documentation includes code books, user guides, surveys, and questionnaires. This is just a screenshot of the variables search tab. And this is what you would get when you click on a variable name. You can see all this information about each variable within the data set. And here's where you would search for publications that have used the HPOG 1.0 study or whichever study homepage that you are looking at. In terms of access to the HPOG and PACE data, all program data sets are restricted use data, meaning that it has sensitive information with a potential for indirect identification of a participant. The restricted data for HPOG 1.0 to 2.0 and PACE are available through what we call secure download, while the data for the newly released HPOG 2.0 participant interview data is only available through our virtual data enclave due to sensitivity. And so you will access that data through a virtual desktop. We encourage users who want to use restricted use data to plan ahead because accessing restricted use data requires some time to submit an application and receive approval. You can begin your application by clicking on the Access Restricted Data button found here. And then you would complete these sections. So access to restricted data at CF Data requires that the principal investigator hold a terminal degree, such as a PhD, MD, etc. However, students or other researchers can still access the data by having a sponsor with a terminal degree, and then you would be listed here under research staff. Other required information includes a description of the intended research project, a data security plan, an IRB letter, and a restricted data use agreement acknowledged by the principal investigator and signed by a representative from your institution. Archive staff are available to assist you with your application and to answer questions, any questions you may have along the way. So please just email us at cfdata-help@umich.edu. And now we are happy to take a few questions. So I see a couple of questions have come in through the Q&A, but you are also welcome to raise your hand and if you'd like to ask a question out loud, and we can unmute your mic. So I see a first question that's come in. Is there a report that summarizes the research that has been done on these data sets? Nicole or
It's a collection of reports. There's not a single report that ties them all together.
Yeah, thanks, Dave. So we have published, from our sponsored work of these data sets, we've published a lot, and those are all available on the OPRA website. But if you're asking for like an annotated bibliography, that's not something that we have done.
Okay. Similarly, I think somebody had asked if there are self-reported earnings since the NDNH data is not available. And if so, was there any analysis of the variance in earnings between the self-reports and the NDNH data?
Yeah, I can take this one. Really good question. We did collect self-reported earnings at every time point, and in the three-year the longitudinal module in the 3-year survey, we collected self-reported earnings at each time point. We did do some analyses, sensitivity analyses of variation between these two measures, the administrative earnings and self-reported earnings. We actually published an article in the Journal of Human Resources using HPOG 1 data that really went into some detail on differences, sort of measurement considerations, and how self-reported earnings differ from administrative earnings. So I know the appendices of all the HPOG 1.0 reports contain a section looking at those differences. So yes, that's available, and in general, the impacts align pretty closely. I don't think there's. I think we can say there's not meaningful differences in sort of the overall impact between administrative earnings and self-reported earnings.
HPOG 2 appendices also contain analyses of the differences, and so do the PACE ones. I seem to recall there's one PACE site where there's hints that might be a bit different, but in general, I agree with Doug's assessment.
Okay, great. Is interview/qualitative data linked at person level to any quantitative data?
It is not. So the qualitative, the transcripts, the qualitative data lives in its own location and can't be linked back to the participant level data.
Okay. For the implementation survey to employer, grantee, management, and staff, is this all quantitative? Was this data collected at just one time point?
Yes, so it is all quantitative. We did not archive any open-ended responses. And it was collected, it was all collected as part of the implementation study. Trying to think if any of those had multiple rounds of data collection. I think the HPOG 2 grantee survey has 2 rounds of data collection. But to my recollection, the PACE and HPOG 1 implementation survey was just 1 round.
I think that's right, Doug. Oh, well, I know we did 2 rounds of grantee survey as part of HPOG 2.0.
Right.
And I believe you're right that we only did 1 for
Yeah.
PACE and HPOG 1.0.
Right. And the HPOG 2 grantee survey is not archived yet, but is coming later this year.
Okay, great. I think we got through all the questions that had come in, but if anyone has any questions that come up, you can always reach us at cfdata-help@umich.edu. And I also want to just quickly remind everyone to visit the CF Data website to request access to these data. And there you can also sign up for our listserv to receive notifications on data release announcements, data webinars and workshops, as well as our quarterly newsletter. So I'd just like to thank everyone for joining us today. And thank you, Nicole and Doug, for sharing all of this great information.
Great. Thank you, everyone, for joining.